Hi, my name is Clay Stamp. I'm your emergency director here in Talbot County. I wanted to take just a minute to talk to you about a few things this evening. I'm here at the Emergency Operations Center with Dr. Frida Wadley. And what we wanted to do is just share some information with you regarding this emerging infectious disease, the COVID-19 virus. From day one, I've talked a lot about our community striking a balance between overreacting and underreacting to this. And I think we've done a really good job. But you know, we're seeing this virus attacking the New York City area, some of the metropolitan areas pretty severely. The governor has stated that we need to take it seriously, and our main tool is to distance ourselves from other people. And Dr. Wadley's going to talk about that in a few minutes. What I do want to say is that the Talbot County community has been absolutely amazing. We've seen people step up and do extraordinary things over the last 3 weeks. We have a number of seniors in this community, and we have kids that are in need of feeding, and they have stepped up to make sure there has been no interruption in that. And it's just remarkable to see the volunteer component of our community. I also want to talk a little bit about our Emergency Operations Center. Here in Easton, Maryland, we have a number of people that are working significantly separated from each other, because that's what we need to do. But we have a daily operation. Every morning we meet at 9 a.m. over the telephone virtually with a lot of partners. We meet initially with the senior policy group, which is our council president, Dr. Wadley, myself, the county manager, and others we pull in. Every day we have a call at 10 o'clock where there's over 50 operational coordination agencies that are working issues with us. We have primary working groups in the area of feeding, medical surge, sheltering, integrating with the business community, and making sure that we're getting a common message out to the public. This is all a part of a system that starts with the federal government, state emergency management, and local emergency management. So we will continue to operate as diligently as we can to make sure we address this unfolding event that we are involved in. What I will say is that, just like I said at the beginning, trying to find that balance between overreacting and underreacting. What I'd say to you tonight is this is not a drill. This is a serious situation. If you don't have to come out of your house, you need to stay in your homes. If you need to come out of your house to go get something to eat, get food, do some critical things, you need to be able to do that. But if you don't need to be out, don't come out, number one. Number two, and if you are out, make sure that you adhere to those things that Dr. Wadley's going to talk about with you. Thank you.
Good evening. I'm Frida Wadley, Health Officer for Talbot County. I know that most of you have probably already heard about the governor's executive order today. It added to the others and essentially is a stay at home. Stay at home unless you're an essential worker or you're out for an essential reason, like to get groceries or medication. And this has caused a lot of questions in people's mind. For example, am I essential? If I get out on the road, is someone going to stop me and fine me up to $5,000 and maybe up to a year in jail? So let's just take a moment and do some plain talking. First of all, the question about are you an essential worker? That is your boss's responsibility to know if his business is essential and if you are an essential worker. If he has trouble interpreting that, then all of us at the Emergency Operations Center will be glad to try to help him interpret that. Even in a pandemic, we have to eat and we have to take the medications. So naturally, those are essential trips that you can take. Now, I know some of you are probably saying, well, then I know how to get around that. I'll just say that if I'm stopped, I'm going to get groceries or I'm going to go get medicine. Let me ask you something. Do you really want to beat that? Because if you look at the number of cases and how they've risen in Maryland over the past few days, if you look at the hospitalizations, how great that increase. If you look at the deaths that triple from Friday to Sunday, do you really want to try to beat that? Because over here on the Eastern Shore, we've been lucky. We've had fewer cases than the middle of the state. But if we want to keep that trend going, we have to slow the virus. And if we want to slow that virus, we have to stay away from each other as much as possible. So we have to take some responsibility ourselves. I can decide what I do. I can decide to take the precautions of going out only when I have to, of washing my hands frequently, because those are going to be the two best self-protections that you can do. So it's easier for us to take that self-responsibility than it is to worry about the others that are not taking it, because we can make sure that we distance ourselves 6 feet from others. Now, we're just beginning in this. This is going to take a lot longer than we expected. We're going to need a lot of common sense and a lot of patience to get through it. I know we have it, and I know we'll use it. Thank you.